How's it going, guys? We have a past level question for pathology for step one. A deceased 71-year-old man, autopsy performed. Prior to his death, he was on dialysis. He had a long history of alcoholism, heavy smoking, diabetes, hypertension. Question wants to know most likely explanation for these findings. For some of you watching this clip here, yes, I've made content on this before, but it's exceedingly high yield. And some of you will think it's too easy. Don't know what to tell you. All right, so let's just hop to the answer choice here. Choice A, colorectal cancer, correct answer. So what we're looking at here is a liver. And you can see that there are lesions everywhere. This makes it obvious for metastases. So they can also write the answer as hematogenous dissemination from the colon, or just hematogenous dissemination. That's it. And then the wrong answer can just be primary cancer or primary carcinoma. Okay, so hepatocellular carcinoma, wrong fucking answer, because if we had a primary lesion, then they would show us just a solitary, isolated, singular lesion. The caveat being that occasionally primary hepatocellular carcinoma can have tiny little satellite lesions that are adjacent to it. So a student might get confused where they're like, oh, I thought multiple lesions were metastases. Yeah, you're right. I mean, look at this image here. Clearly they're everywhere. This is very classic buzzy Mets. But if you had one big lesion and then maybe three tiny little lesions immediately adjacent, that could be primary HCC. So that's your caveat, okay? So hematogenous dissemination from the colon, as I said, exceedingly high yield. They love this for USMLE. So real quick, hepatorenal syndrome, wrong fucking answer. Non-existent diagnosis on USMLE. It's always a distractor if it shows up. For whatever reason, liver failure can sometimes cause problems with the kidneys, okay? It's thought to be related to changes in blood flow. And classically, there's no change on biopsy if you do a kidney, okay? So usually it'll have a normal biopsy. As I said, I haven't seen it show up as an actual correct answer on NBME form. Choice C, wrong fucking answer. Choice D, pileosis hepatis, wrong fucking answer. So I just be an asshole because if you don't know an answer, sometimes students choose weird sounding shit. So apparently this is multiple blood-filled cystic cavities within the liver that can have many different etiologies. Now, I threw this in here also because back in the day, over a decade ago, when I was studying for the numerical step one, we used to memorize dumb shit such as this, thinking this would get us a 280 on the exam. Non-existent yieldness, wrong fucking answer. Choice C, polycystin mutation, wrong fucking answer, refers to ADPKD, autosomal dominant polycystic kidney disease. So that's going to be chromosomes 4 and 16, and that's going to be obviously patient 30s to 40s who has development of cysts within the kidney, can get a surge in blood pressure. That's the highest yield point, actually, is that you're going to do serial blood pressure checks for these patients that the cysts can impinge on the microvasculature within the kidney, causing a surge of RAS. So they can frequently die from hypertensive phenomena. That MRI angiogram, circle of Willis, looking for Barry aneurysms, is not the correct answer in terms of the follow-up of these patients. Okay, so you're going to choose serial blood pressure checks, MRI angiogram, circle of Willis, wrong fucking answer, okay? You're only going to do MRI angiogram screening in patients who specifically have a parent who had a Barry aneurysm in the setting of AD-PKD. You say, well, what about AR-PKD in pediatrics, chromosome 6? Apparently that's fibrocystin mutation. It's not the same thing as polycystin. And AR-PKD pediatrics can be associated with hepatic fibrosis. Doesn't fucking matter. USMLE is not going to force you to make that distinction, fibrocystin and AR versus polycystin AD. But they do want you to know that AD is adults, whereas AR is kids. Wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.